Hey everyone. In today's video, we're going to talk about a topic that's very relevant right now, viral infections. With the global pandemic of COVID-19, many of us are focused on staying healthy and avoiding getting sick. But whether you're worried about coronavirus or just want to better understand how viruses work, stick around for some important information. What is a viral infection? First off, what exactly is a viral infection? Well, as the name suggests, it's an infection caused by a virus, which is a microscopic organism that can't reproduce on its own, but instead invades host cells and takes over their machinery to reproduce and spread. Different viruses can cause different symptoms and affect different parts of the body. Some examples of viral infections include the common cold, influenza, the flu, herpes, human papillomavirus, HPV, HIV, AIDS, COVID-19. How viral infections spread. So how do viral infections spread from person to person? Well, it depends on the virus in question, but generally speaking, many viruses are spread through bodily fluids like saliva, mucus, or blood. This can happen through close contact with an infected person, such as kissing, hugging, or shaking hands. Exposure to infected droplets in the air, such as when someone coughs or sneezes. Touching a surface contaminated with the virus and then touching your face. Some viruses, like HIV or hepatitis B and C, can also be spread through sexual contact or sharing needles. What are the symptoms of viral infections, and how are they treated? Again, it depends on the specific virus, but some common symptoms include fever, coughing and sneezing, sore throat, runny or stuffy nose, headache, fatigue, muscle aches, nausea or vomiting, diarrhea. For many viral infections, there is no specific treatment. Instead, people often focus on treating the symptoms and letting their immune system fight off the virus. This might mean getting plenty of rest, drinking fluids, using over-the-counter pain relievers, and avoiding contact with others to prevent spread. In some cases, antiviral medications may be prescribed to help fight the infection. Prevention of viral infections. Here are some tips. Wash your hands frequently with soap and water for at least 20 seconds. Cover your nose and mouth when coughing or sneezing with a tissue or your sleeve. Avoid close contact with sick people. Stay home if you're feeling unwell. Get vaccinated for common viruses like the flu or HPV. Practice safe sex and avoid sharing needles. Of course, in the case of COVID-19, there are additional measures you can take, like wearing a mask, practicing physical distancing, and getting tested if you're experiencing symptoms. Essentially, a virus is a tiny infectious agent that can only replicate inside the living cells of other organisms. Viruses have no cells, no metabolism, and no ability to reproduce on their own. They're basically just a bundle of genetic material, either DNA or RNA, wrapped in a protein coat. Because of this, viruses need to find a host cell in order to replicate and spread. How do viruses cause infections? When a virus finds a host cell, it binds to the cell membrane and infiltrates the cell. Once inside, the virus uses the cell's machinery to replicate its genetic material and produce new virus particles. As the virus particles accumulate, the host cell eventually dies or bursts open, releasing the virus particles into the surrounding tissues. These new virus particles can then infect other cells and repeat the process all over again. Different viruses infect different types of cells and tissues, which is why the symptoms of viral infections can vary widely depending on the virus. For example, the flu virus typically causes respiratory symptoms like coughing and fever, while the herpes virus can cause painful sores in the mouth or genitals. How do viruses spread? How do viruses spread from person to person? Well, this can vary depending on the virus, but some common methods of transmission include direct contact with an infected person's bodily fluids, such as saliva, blood, or semen. Inhaling respiratory droplets when an infected person coughs or sneezes. Touching a surface contaminated with the virus and then touching your own nose, mouth, or eyes. Some viruses can also be transmitted through food, water, or insect bites. How to prevent viral infections. The best way to do this is to practice good hygiene and avoid contact with infected people. Here are some tips. Wash your hands frequently with soap and water. Avoid touching your face, especially your nose, mouth, and eyes. Stay home if you're feeling sick. Cover your mouth and nose when you cough or sneeze. Get vaccinated for viruses like the flu if a vaccine is available. Practice safe sex and avoid sharing needles. In addition, during a pandemic like COVID-19, it's important to practice physical distancing, wear a mask in public, and stay up to date with the latest public health guidelines. Viruses are fascinating and complex creatures, and it's important to understand how they work in order to keep ourselves and our communities healthy. If you have any questions or additional tips for preventing viral infections, leave them in the comments below. Thanks for watching, and be sure to stay safe out there. And that's a wrap on our video about viral infections. Again, this is an important topic that affects us all, so it's worth understanding.
And don't forget to like, comment, and subscribe for our next video.